Welcome to the Wild Ag Podcast, where we'll serve as a connection point for landowners and conservation professionals who want to integrate conservation and agriculture. I'm Dr. Andrew Little, Professor of Landscape Ecology and Habitat Management and Extension Specialist at the University of Nebraska.
And I'm Nate Pfluger, Precision Ag Coordinator for Pheasants Forever and an avid outdoorsman with friends and family in my free time. Together, we'll work to bring you perspectives from both landowners and conservation professionals for discussions on soil, water, and wildlife in ag-dominated landscapes. Welcome back to the Wild Ag Podcast. My name is Nate Pfluger, joined by my co-host, Dr. Andy Little. And today we actually have Dr. Jesse Bell with us from the University of Nebraska Medical Center. And this is a unique episode in that we've talked about nitrates from a few different angles. We had Crystal Powers on kind of setting the stage for nitrates in ag landscapes. And then we actually brought Jackson Stanzel with Sentinel Ag on to discuss how they're kind of trying to curb that nitrate issue, fertilizer use within ag systems. And we've talked a lot about maybe the medical issues that can come from contaminated groundwater with nitrates. So we wanted to rope in an expert in that area to share some knowledge, and that is where we found Dr. Jesse Bell. So with that, would you please introduce yourself, and we'll go from there.
Sure. So I'm Jesse Bell. I'm at the University of Nebraska Medical Center. That's where I'm primarily located. But I do have a position that runs across the University of Nebraska system. So I actually have a position over here at UNL as well.
Cool.
And I'm also a director of the Water, Climate, and Health program. And I'm also a director within the Daugherty Water for Food Global Institute that runs across the University of Nebraska system. And so and I'm actually a native Nebraskan. I was born in Bloomfield, Nebraska, did my PhD at the University of Oklahoma.
Okay.
And then went on and worked for NOAA for a while, National Oceanic and Atmospheric Administration. And then I worked at CDC, the Centers for Disease Control and Prevention, before I came here.
That's awesome. Yeah. Thanks for joining us today.
Yeah, it sounds like you're into a lot of stuff, or you head up a lot of stuff. So we're lucky to have you here. So kind of getting into that discussion, how did you become interested in the nitrate issue? Was it just part of your job, or have you always kind of looked at that as an issue that you wanted to address?
Well, that actually kind of came up when I moved here to Nebraska. And so I'd been looking at other environmental issues with some of the work that I've been doing previously between NOAA and CDC. But then when I got here, there were a number of different people at the University of Nebraska Medical Center that were working on this issue and concerned about this issue for a variety of different reasons. And when I started talking with them and interacting with them and doing some research with them, I realized the complexity of this, but also the importance of it. And so that was back in 2018. But the University of Nebraska Medical Center had been working on this prior to me getting here. And there's more work around that as well. And so with that, hearing about some of these issues, that's when I realized that there was a real opportunity to do more work here in Nebraska to try to make sure we're educating and doing outreach around this issue, and also just researching it as well and making sure we have good research to understand what's going on. And I had the good fortune in 2020, we developed the Water, Climate, and Health program, and we came into the Daugherty Water for Food Global Institute. And one of the main goals from that was understanding water quality issues in the state of Nebraska and what does that mean for impacts on human health.
That's really interesting. Yeah. Yeah. And a little connection point there. So my dad, unfortunately, passed away several months ago, but he had spent 30 some years working for the Pennsylvania Department of Environmental Protection, addressing water quality issues, especially in ag landscape in south central Pennsylvania. And so I know he spent a lot of time working in that realm, which that actually kind of facilitated my interest in just conservation and working landscapes and thinking about how do we address some of these complex problems we have today, as you're alluding to, through nitrate management, through just other types of management on the landscape, and ultimately helping producers think about ways they can optimize their system more efficiently while addressing some of these problems that we have, as you're alluding to. So yeah, that's cool.
So you mentioned that you guys have a strong focus here in Nebraska, being obviously located in Nebraska, but the nitrate issue, it's bigger than Nebraska, correct? And even bigger than just the U.S. in general. Is that correct?
Yeah, most definitely. You know, when we're talking about the nitrate issue, Nebraska, obviously, we're very impacted by it. We're mostly groundwater fed, especially when we're talking about our drinking water and the water we consume.
Sure.
And, it's, what is it? Omaha gets its water from surface water. Lincoln is a combination of surface and ground, but I think pretty much the rest of the state, all of our communities and people living out in the rest of the state, I think is getting it from groundwater.
Sure.
And so that's where that potential contamination is concerning, or most concerning for me. But then, we're, Iowa, Kansas, for some of the places local that have been interested or addressing this issue. You can see it across the entire United States, and then internationally, all the way from Denmark, Netherlands, New Zealand, throughout Europe. They're all concerned about this issue because of the impacts that it has on human health and the fact that in a lot of places we're seeing increases in nitrate contamination in water sources.
Sure.
So when did the University of Nebraska, or specifically the medical center, kind of focus in on the nitrate issue? Do you know that?
Yeah, that's actually kind of an interesting story, and I wish my colleague could be here. So we work a lot with Don Coulter. He's a pediatric oncologist over at the University of Nebraska Medical Center. Don works on cancer, with childhood cancer. And with that, he was noticing that there were a number of cases coming in, especially in certain communities. Aurora, Nebraska in particular is one of those communities. And he was seeing multiple kids coming in with cancer, especially aggressive forms of cancer. Pediatric cancer is rare. And so for a small community like Aurora, Nebraska, which I forget exactly what the population is, but it's not real big. For those number of cases with aggressive forms of cancer, that became concerning to him. And he was like, well, what is going on here? Statistically, it just should not work out that way.
Sure, yeah.
We one of the things we know, I think somewhere around 10% of pediatric cancer is caused by genetics. So 90% is other things through your environment in some capacity.
That's interesting.
And so he was looking at this and he started having conversations with various people. And some people said, maybe look at water.
Sure.
And that's when they started up some of this research and trying to understand what was going on in Nebraska as far as cancer. And here's another little fact. Nebraska has one of the highest rates of pediatric cancer in the U.S.
Wow.
We're, especially when we're talking about the center of the United States, we're the highest, if not, we're one of the highest, if not the highest. And so with that, they were trying to look at some of these relationships. And so they started doing work with, there was teams at the University of Nebraska Medical Center that started looking into some of these relationships and found that areas where we had higher contamination of things like nitrate and atrazine, that's where we were seeing some of the highest number of cases of pediatric cancer. But again, kind of going back to it, this isn't the only place that's done this type of research. They've done research in Iowa, in Denmark, and California, and across the United States and across the globe. And they find some of these associations associated with pediatric, or not just pediatric cancer, but all cancers and potential and nitrate contamination and water and drinking water, higher levels.
That's really interesting.
So did some of that early research from your colleague, did that help set the regulatory limit for nitrates in drinking water?
That actually goes back further. I'll kind of try to take it all the way back, as far back as I know. And I think it was, is it 1920s or 1940s? I forget now. Is when they first identified that nitrate could potentially be harmful to human health, and especially infants is what they became interested in.
Okay.
And that was one of the first cases back in the early 1900s in the U.S. is when they identified the association of nitrate and methemoglobinemia, which is otherwise known as blue baby syndrome. And from there, we just did more research, and they've found stronger associations between nitrate in drinking water, especially if the formula developing methemoglobinemia, or otherwise known as blue baby syndrome. And that's actually what that regulatory limit is set for, that 10 parts per million, that 10 milligrams per liter.
Okay.
That is for blue baby. It's not for other adverse human health outcomes. And when they first established that by a Safe Drinking Water Act standard, I think it was in the early 90s, 92 if I'm remembering correctly. And so it's not associated with pediatric cancer or any other cancers. It's only set at that limit for blue baby. And blue baby comes about because of children on formula, 6 months of age especially, because that's their primary source of food.
Mm-hmm.
And if they're mixing that with water that's highly contaminated, now all of a sudden, that's their only source of food and nutrients. And if it's highly contaminated, that's where that development of blue baby comes from.
Sure.
And so that's some of the earliest work associated with that association with blue baby syndrome and nitrate. But that doesn't get to all the other health impacts that have been seen since then.
Sure.
And I want to dive into the blue baby a little more and the other health issues. But can you put the 10 milligrams per liter into perspective? Like, just how much is that? Because that's not a lot.
It's not a lot. It's not a lot. I mean, that's a hard one to put into perspective. I'm trying to think of the best way of thinking of that. I think, just background noise is somewhere between like 0 to 3, if I'm not mistaken, for nitrate in drinking water, where, it's just like, it's kind of just like a standard amount. So 10 is not a lot of contamination. In places, you can see upwards of 20, even 50 plus in places in Nebraska and other places around the world as well. And so, 10 isn't a very high number in the grand scheme of things. And how do they come up with that number as like the standard? That's we could do an entire podcast on that by itself.
Well, I'm hoping there was some sort of research that went into it, as I'm sure there was, but
Yeah. A lot of research and trying to understand some of these relationships and associations.
Has there been some refinement to some of those numbers over time, like, in kind of sticking to that, like 10, but like, has there been adjustments? Maybe it was a little higher or lower. Like, I'm just curious, like.
That's a good question. I don't think that it's been changed too much since it was put in at that 10, but there has been discussions about moving that down.
Okay.
And not only here in the United States, there's some people that are talking about that, but also internationally as well. I was actually just talking with a colleague of mine from Denmark that they were talking about potentially moving that because of some of those other adverse health outcomes that we're talking about.
So kind of, you mentioned talking with your colleague in Denmark. This 10 milligrams per liter sounds like it's the number's out there widely, not just here in the U.S., right?
Yeah.
Okay.
Yeah, they have, I forget what the number is over in Europe. They have a similar standard over there. It looks a little bit different because they use different units. But basically it's roughly the same. It's the same amount. It's around that 10.
So moving on to, why are nitrates an issue to begin with, as far as human health concerns, I guess?
Yeah, that's a good question, because nitrogen's important for everything, right?
Sure, yeah.
I mean, us, we're nitrogen's important for us to even exist. It's important for plants to grow. But, in all things, it's moderation, right?
Sure.
We can look at simple things like table salt, right?
Yep.
Table salt, perfectly fine. We need sodium. But if you take too much of it, it can actually become lethal.
Yeah.
And that's that balancing act that we do with anything that we're trying to ingest. Like, there's always a potential that there could be too much of something. And that's part of it with nitrate. I'm going to talk about it just purely from that cancer perspective. And so if I had a glass of water here in front of me, and it'd say that water is highly contaminated with nitrate, and I take a drink of that, first thing that happens is it interacts with my bacteria in my mouth. And my oral bacteria then converts that nitrate into nitrite. Then that nitrite gets down into my stomach. And then when it mixes with the acids in my stomach, it can develop into an N-nitroso compound. That N-nitroso compound has been known to be cancer-causing. And there's been numerous studies looking at that association. They've looked at those N-nitroso compounds in animal studies and in laboratory settings, and they have found that it can lead to cancer or birth defects. And so that's one of the areas. And now when we're just talking about from the blue baby syndrome, it's because the way that it binds with the oxygen. And so that's where it comes from. It just means that the blood is not able to transport oxygen efficiently, hence why the baby looks blue.
Sure.
And why it's blue baby syndrome, because the child looks blue. And so this just kind of gets to some of the complexity of how these things interact inside our body and why that could potentially turn into an adverse health outcome in some capacity.
That's really interesting.
Yeah, very interesting. So if you were trying to, from the blue baby standpoint, is there something that you can add to the formula if you know that the water is high in nitrates? Not that you would want to use that water anyways, but is there anything that you can add then to stop that from binding to?
There are medications that like infants can take after, if they're developing it, to try to mitigate against that. I don't remember what those medications are. I haven't worked on that side of the treatment side, and so it is treatable in that regard. Now, when we're talking about cancer, for example, diet plays a huge role. There's been studies, really nice studies over in Iowa, and I know we're in Nebraska. Maybe we shouldn't be talking about Iowa, but
that's okay.
But in Iowa, there's been some really good cohort studies looking at women's health. And so they followed these individuals for years and looking at what are they actually consuming, the foods that they eat, what are their just daily lives like. And with following them over multiple years, they also look at their water that they're consuming. And a lot of them were on rural water or private wells. And so they knew which ones were being exposed to higher levels of nitrate. Now, they found within those populations that there were higher incidence of certain types of cancers. Like in postmenopausal women, they found higher rates of, I think, ovarian cancer and some reproductive and cancers as well. But when they looked at diet and adjusted for a diet, they noticed that there was some shifts.
Well, interesting.
And so if people ate, for example, a lot of processed meats that also has potentially high nitrate present, higher rates of cancer. But if they ate a lot of fruits and vegetables that had more antioxidants, vitamin C, lower. And it was very noticeable in the graphs. Like when the researcher from the National Cancer Institute at NIH presented the results, to me, it was absolutely shocking. That was my biggest takeaway, because you could see it as plain as day, like the difference between the outcomes between the two. And so that's why, diet does play a role in some capacity with these individuals. And that's why when we're talking about cancer, not all of us are going to get impacted equally.
Sure, yeah.
We have so many differences in what we do on a daily basis.
Yeah, well, and I kind of, because since I do a lot of wildlife research, I just think about all the variability amongst animals. And then similarly, you guys are doing that on the medical side, and there's just so many, everybody's different. Everybody kind of, they do have different exercise regimes, or maybe they don't have any, or they eat different foods. And there's like all these different pieces. It's hard to create these kind of standardized studies to be able to address all that. But it's really interesting to say that, because I think it just illustrates the complexity of it. There's all these different little puzzle pieces that you have to kind of try to put together to address these bigger questions. So it's interesting.
Yeah.
And so you briefly mentioned processed meats potentially being an issue and leading to higher forms of cancer. Is that because nitrates are used as a preservative in those?
Yeah.
Okay.
Sure.
And honestly, that's one of the things I find kind of fascinating as well, because it just kind of illustrates that our understanding of that potential threat. Because in the United States, for example, with processed meats, we've changed the way that we, from my understanding, I'm not an expert in how the production happens with like hot dogs or anything like that, but they add vitamin C to it now to try to reduce some of that risk.
Oh, interesting.
Very interesting. So going back to maybe preventing this, if you have nitrates in your drinking water, you mentioned the bacteria in your mouth. Obviously, the bacteria in your mouth is probably important for a lot of reasons, but is there a certain bacteria that causes this issue, and can you eliminate that bacteria, and would that be beneficial?
Woo! Great question. I can give you my most educated answer for this, but I can't give you the perfect answer for this. I'm sure there's somebody out there that knows. I know that is like one of the variabilities that some people with the oral bacteria that you have in your mouth, some people are more likely to convert that from nitrate to nitrite. Now, which bacteria exactly that is, I don't know for certain off the top of my head. But I think that is something to even consider to some extent, is looking at some of these ways that we can reduce risk. Now, it's always a balance too, right? And so if we change that oral, the bacteria, those flora in your mouth, now all of a sudden maybe that increases your risk for something else, like maybe dental hygiene related issues.
Oh, sure.
And so there is always a balancing act from that, and knowing that, if you solve one problem, it might lead to a different one.
Yeah, absolutely. And that's, part of the issue, kind of like Andy mentioned, there's just so many things at play that it's
like
extremely
the food web.
difficult.
You just pull one string and then everything else changes.
Yeah, for better or worse.
Yeah.
So one other question in this area, I guess you mentioned vitamin C being added to some processed meats. So are there other things that you can take to maybe lessen your risk of issues from nitrates?
Yeah, I would kind of go back to that. Diet definitely does play a role. Any medical doctor would tell you that, eating more leafy greens and vegetables and fruits is always going to be important for you in some capacity. Now, as far as like adding it to water to reduce that risk, that one, I don't know. I think there's probably more work that needs to be done to see about that kind of mitigation. But just having that awareness of the diet that you're having can help with reducing your risk. I mean, that's part of it, right? Vegetables have nitrate in them, but they're not. But people that eat vegetables, it's not a as big of concern for developing these types of cancers. And that's because these antioxidants and vitamin C and all this stuff is present within those vegetables, which can change in the way that when it interacts with your stomach acid.
Sure. That's really interesting. Yeah, I just thinking about, so my wife has been really passionate about trying to start pollinator garden in her house and trying to get more natural vegetation in the backyard. And so kind of getting away from kind of having a traditional lawn or whatever. And so she's been like, we need to get back to, we eventually would like to get a farm at some point, but she wants to get to that point where we are more reliant on the land in the sense of, not going out and buying a bunch of processed items. And I think just generally that, there's a lot of literature on that. It's better to have that, more healthier options. And you look at probably historically people in the 1800s versus today. Granted, they also had a suite of problems, but, they were living on the land more than probably what a lot of us are today traditionally, just for a variety of reasons. So, but I think it's really cool to see that difference.
Yeah.
Yeah. Public service announcement. Eat fresh food.
Yeah, absolutely. Yeah, absolutely. Yep.
So now we've touched on some of the human health issues already, but I want to dig into those a little deeper. You brought up children. In Nebraska, we have one of the highest rates of pediatric cancers. Are there any other issues outside of blue baby that can arise that maybe parents would notice or they can dial in on if?
Yeah. And there's multiple issues at different levels. And so, for me, the impacts on childhood health is incredibly important. And that was one of the reasons that this kind of got flagged by my perspective. Now, blue baby syndrome, cancers, et cetera, those are of concern, especially with younger individuals. But then with adults, we also see increased risk in cancer. And I talked about that with postmenopausal women. Really solid study that was done over in Iowa and North Carolina as well. And there's been some work out of California where they've been looking at some of these bigger cohorts, and Denmark and Netherlands have also done some really good work in understanding some of these adult cancers. And there has been some potential linkages with Parkinson's, Alzheimer's, and some of these neurological related issues as well. Still more work needs to be done in that in that realm. With adults, there's also just general risk of some more minor related issues, headaches, nausea, stomach aches, stuff like that. Sure. And then the other part that raises some flags for me is that maternal fetal health.
Oh, yeah.
One of the earlier studies that I've seen is looking at, so this is back in the 90s at some point in Indiana. There was multiple women that were having what medically is known as spontaneous abortions, otherwise known as miscarriages,
Oh, sure.
in rural areas in Indiana. And so CDC came in and did an investigation to try to figure out what was going on with those women. And when they went and looked at them, they realized most of them were on private wells. And I think all of them were on private wells. And their nitrate concentrations were somewhere between 19 and 26, if I remember right, milligrams per liter. Wow. So much above that 10.
10, yeah.
And that was the only thing that they could find as a commonality between all of those different households. And anecdotally, from what I've heard, is that when they came in, they provided them a different source of water. Some of those women went on to have healthy births afterwards.
Oh, okay.
And there's been a lot of literature, or not a lot, but there's been literature that is scientific literature, research studies that have also identified some of this and impacts. There's been studies looking at preterm birth, so when the fetus doesn't go to full term.
Mm-hmm.
Also, less fetal growth, and so the fetus is a little bit smaller because associated with nitrate. They've been seeing some of that, and there's a pathway for this as well, and that's through the umbilical cord. When they looked at the blood in the umbilical cord, they find that it's susceptible to methemoglobin, which is what causes methemoglobinemia.
Sure.
And so there is that potential pathway as well for adverse health impacts. And there's also been work looking at malformations, so birth defects, and they found a number of studies have found an increased potential incidence or occurrence of some of these malformations, especially the central nervous system, so brain and spinal cord, with high nitrate exposure in drinking water.
That's really interesting.
Yeah, without a doubt. So we are seeing all of this in Nebraska. Are there other states in the Midwest that are also dealing with these similar issues?
Yeah. That's Iowa has, it's been pretty constant over there with some of the issues that they're facing. Kansas has been concerned about some of the growing issues around nitrate, especially in the western part of the state. I get contacted from public health departments in different parts of the U.S. as well. Wisconsin and different places have reached out to me about some of the education and outreach. I will say this, I think we're doing a really good job around education.
Good.
And trying to build those bridges so people understand these adverse health outcomes. And I'm not saying we're doing it perfect, but we're trying our best to make sure that we're getting that education outreach, not only to the communities, but also to the people that interact with the communities. And we're trying to work with local public health departments, with local healthcare providers, to make sure that people are understanding some of these issues as well.
That's really good. Yeah, it's great you guys are doing that, because I think that's really important. It's and that look at that from my realm as an extension. That's basically where we're taking that research out to show people. Yeah. Here's what you can be doing on your land or your property or wherever in your house. We do a lot of different things in extension, but to that point, the education is such a critical piece, because if we don't take that research out and share it, then it's really not kind of fulfilling that really ultimate mission of taking that back to the public and helping them make the better choices based on information we're coming out of these studies. So, yeah, I mean, and that was part of it for me when I started looking at this issue and understanding it more when I first moved back to Nebraska. I looked at this and I saw, well, there are potential adverse health outcomes, and I realized that we're not doing a good job of educating people around this. And so for me, it seemed like a moral thing to be able to take some of this research that's going on and making sure that that's getting translated over to the general public, so that they can make informed decisions to try to take action, checking their well,
potentially trying to do mitigation, maybe putting filtration system, or even broader actions, which I know you all are talking about, long-term solutions.
Yeah.
Do you have any evidence that the public is listening and actually taking steps to test their wells and put systems in place?
I don't, and I wish we could get to that level. And I'll have to say this too. I think we still need to do a lot more around it. I can say something anecdotally, and so we've done a lot of. We try to do more education, communication. Some of this has gotten in the news, talking about some of these things as well. And I can say this. So my aunt came to me when I was back up in Nebraska. She's on a private well, and she was like, we just got our well tested. And it was like the first time they'd ever tested our well. And she goes, I got these numbers. I want to know what it's about. And so right there in that regard, I was like, well, maybe we're not hitting everybody, but at least I got one
you
person.
got one person. Yeah, no, absolutely. Well, and I think that's one of the biggest challenges is kind of that behavioral modification and people actually taking that information and doing something with it. And I would argue pretty similar to what I deal with is that it takes time.
Yep.
And it's not going to happen overnight. That's not reality. And you can educate and provide a lot of information, but it's eventually, making stuff more accessible to people, like the well testing as an example. I know Department of Environment and Energy, which now changed over, but they had a program, I think it's still going on, that would help private landowners and private wells put in those mitigation systems on their property. So there's, but again, it's a lot about education and getting more of that out there. And even if you put a lot of information out, it doesn't necessarily mean it's going to translate into action on the landscape. That's an excellent point, and that's something we want to continue to track over time, finding new metrics to be able to ensure we're successful in educating people out there about some of these topics. So,
yeah.
So going back to your aunt's question, do you guys have resources that help read those numbers or that output from a water test?
Not yet. We need to develop some of those. Now, there are resources both within what was NDEE.
Oh, sure.
You can talk with your natural resource district, local health department. There's resources here at the University of Nebraska around some of this. But we still need to do a better job of creating some of those education outreach materials around this. I'll be 100% honest on that. And because it's complex, right? If you hit 9 milligrams per liter instead of 10, well, what does that mean?
Sure.
And honestly, I can't even tell you what that means.
Yeah.
And I don't know when we're going to get, or if we'll ever get to that point. But I think at least having people understand that 10 milligrams per liter is the standard for water quality, but also understanding that, if there's opportunities to mitigate even below that, that's probably a good thing to do as well. Because there is some literature out there that says that 10, even though it's set for hemoglobinemia, does not mean it's set for all potential adverse health outcomes. And so there has been some growing literature that says, scientific literature that says that's potentially not low enough for reducing risk in other health areas.
Have you ever received any pushback from the general public or just anyone saying, how can you point at nitrates as the issue? When you get a water sample, there's a lot of other maybe potential chemicals in there that are causing this issue. So what would you say to folks that are asking that question?
Definitely. We've definitely had a number of questions like this. And I would even argue, yes, one, it could be a variety of things. And, we don't live in a single exposure world,
Sure.
right? And that's one of the reasons when we look at children's health versus adults' health, children are a little bit easier to study on as far as like what the environment is doing to their health compared to adults. Because as adults, we've made a lot more decisions. We lived in various different places. Maybe we have various life choices that we've made that could potentially be impacting our health. And so our environment's less of that factor, like the actual physical environment that we live in. Whereas children's health, it's more driven by the physical environment that they're living in. And so kind of going back to, when somebody says that, yeah, it could be other factors as well. It could be factors interplaying with each other. Like I said, we don't live in a single exposure world, there's been studies that have looked at nitrate and atrazine and, two different factors together and how that might be driving in combination some of these health impacts. There's also, it could be the canary in the coal mine, right? Nitrate's
Sure.
much cheaper and easier to test. We're not testing every pesticide or every chemical that's in that water. And so it could be just identifying risk.
Mm-hmm.
But then also on top of it, and nitrate has also been shown to cause more uranium to be, suspended in water. If I'll let people over in the like Kerry Webbers and people like that who are doing the research on that talk about that. But that could be a factor in there as well. But what I would say, when we're talking especially with, blue baby syndrome, we understand that relationship.
Mm-hmm.
When we talk about cancer, it's not just like that, there's like the correlation versus causation that people talk about. Anybody that's worked on statistics or anything. And I'm going to use an example here, and maybe you'll erase it from the podcast later. But, it's the best way I can kind of relate it back to something is, there's a very famous study where they were looking at ice cream sales, and I think it was in Chicago, and violent crime rates. And they found out as you go through the year, especially over the summer, ice cream sales go up, violent crime also goes up. And so that's correlation. But it's not causation. Now, and this is where I think what we're doing is so important because we're identifying mechanisms as well. And it would be one thing if we were looking at that ice cream sales and then we went in and we started testing ice cream, we realized, oh my goodness, there's a chemical in here that makes people more violent.
Oh, yeah.
Now that's a difference between just a
Sure.
random correlation and some potential causal factor in there. And that's what we have with nitrate. Like we know that can be related back to cancer, and we know the pathway that can be related
Sure.
back to cancer. And then I would also say there's been a lot of really good studies out there, both the animal studies where they've, mice, rats, monkeys, dogs, et cetera, where they've been exposing it in a laboratory conditions and found increased rates of cancer and birth defects in those. But there's also those really good cohort studies. And that's like what they did in Iowa and North Carolina and California, where they do, and Denmark as well, where they look at more closely some of those chemicals that are in the water and looking at nitrate and finding that association. But I still think there's more work that needs to be done there to understand what are some of these other exposures in the water. We'll get there, but it's
Sure.
But there's enough of a concern there with nitrate for me that I'm going to communicate around that.
Yeah. Well, and
As a
I
starting
think COVID was a good illustration of you were talking about with adults earlier and just exposure. Like people were getting exposed in a variety of different environments. And then you had people that were very healthy that passed away and others that were not. And then you're sitting there going, well, like what's going on? And, to me, it was really a great example of the unfolding of a scientific, study in a sense of experiment of how does science change through time? And again, just not to stay focused on that, but that's kind of a good illustration tied back to this nitrate thing that we're constantly learning new things all the time. And there, like you said, it might be a relationship with some of these other factors, but there's enough of a relationship already that you've seen that it's like, okay, this is definitely a component, but there could be other factors, to your point, Nathan, that could be at play as well. So,
yeah, and if I can just jump in here, because I think that's such a great point, and from a public health and a health perspective, that I just wanted to throw out here. We know the association between smoking and cancer.
Mhm.
Like it's
Sure.
pretty well established at this point. But not everybody that smokes develops cancer.
true. Yeah.
Humans are complex systems. We have a lot of different other things that are going on. We have genetics, we have environment and so if you had a group of people and they were all smoking, some of them will develop cancer, but
Mhm.
some of them might develop lung cancer. Some might develop head and neck cancer.
Mm.
Some of them
Sure.
might develop COPD. Some of them might develop other respiratory related issues. cardiovascular, whatever. And then some of them will develop nothing.
Yeah.
And that's the crux of it, right?
Sure.
It's what makes it so complicated when we're talking about understanding people, because one person's exposure does not necessarily mean another person's, or one person's exposure doesn't mean that health outcome will be the same as the
Correct.
second. And this is also one point that I want to make sure I make here as well. I'm not saying that nitrate is causing every cancer that we're facing in Nebraska. Like, it's just, that's not the case. It could be a variety of different things that's interplaying and why Nebraska has higher rates than others. But for me, there's some level of risk, and we do have high rates of cancer here in Nebraska. So at least what I can do is help with education and communication to try to get people to reduce their exposure and let them be informed on this issue so they can make decisions for themselves.
Yeah. Yeah, absolutely. Well, and I was thinking back, so I'm just curious as we're talking. So you mentioned about that Aurora example earlier. So what in general makes Nebraska, you were saying it's kind of one of the top states in the country, be so susceptible to having higher pediatric cancer rates versus other states that probably are utilizing similar nitrogen in a variety of platforms? I'm just curious, like, is there any directionality that's been seen or not? Or, I'm just,
Great question.
Yeah.
And I think that's where we need to do more work and trying to understand some of these relationships. I've thought about this quite a bit. It could be everything from that we have a high percentage of people on groundwater, and a lot of those are untreated systems. There's just a variety of different factors that could be interplaying there that I don't know for sure.
Sure.
And it could be other things. It could be genetics. It could be a lot of other factors as well that are part of this problem. So I wish I could say that I knew what that answer was. I know we're actively working on that to try to better understand why is it that Nebraska has higher rates, and also higher rates of some aggressive cancers. So Nebraska, there's been some studies that have done, especially with children, of higher rates of more aggressive cancers, higher rates of cancer mortality. And when I talk to Dr. Don Coulter, he'll tell you there's a standard of care for everybody. So if you get treated for cancer in Nebraska, it's the same treatment that you're going to get in any other place in the United States.
Yeah.
So the treatment's not different. Sometimes it's just the forms of cancer.
Yeah.
And so that's where he's also concerned too, because he saw more of those types of cancers here.
Yeah, that's really interesting. The wheels are turning in my mind, just kind of thinking about that. And so once, not to get going down a rabbit trail here, but, once a person gets cancer, obviously if somebody was drinking that, say it was groundwater, it was contaminated, and they were doing that consistently, and then, is there a point in which you could go out of that system and then potentially recover because you're not, constantly, ingesting something contaminated? Or is it once you get established in your system, like that cancer just going to take over? This is my I will say it's my lack of naivety of just kind of cellular research and understanding all the complexities with cancer research. So I apologize if it's a really basic question.
No, that's not a basic question. It's a good question. And that's the kind of question we need to answer.
Yeah.
And I'm going to say that we don't have a good answer for that right now. Hopefully at some point we can get to that point where we can have that kind of specificity, be able to understand exactly what's going on with different types of exposure. I think at this point we're just too naive to what's happening to be able to answer that. But it is a good question, and it's an important question too, because those are the type of things that can help us with mitigating and reducing risk over time.
Yeah.
Because, I always talk about water quality in the U.S. We don't really think about water quality here.
Yeah, you don't. Yeah.
I mean, there's certain issues that have popped up in various places, but for the most part, you will turn on a tap and you'll drink the water and you're not expecting to potentially die from a diarrheal disease.
Yeah, correct.
There's a lot of places in the world.
Yeah, you would.
Yeah.
Oh, yeah.
100%. And so those are very acute issues. here we're talking about something that's more chronic.
Hmm.
And that is the complexity of it, because a chronic exposure, and again, it kind of gets back to your individual biology.
Yeah.
What I get exposed to and what you get exposed to and what you get exposed to, we can all do the exact same thing. We'll get a different outcome for each of us.
And I think to answer a lot of these questions, correct me if I'm wrong, but research is what we need to actually implement and do to get those answers.
100%.
But unfortunately, it takes a long time to conduct research and high quality research.
Oh, yeah. Yeah. Oh, my goodness. Like, these cohort studies that I'm talking about, which are kind of, I'm sure some of my colleagues would probably scoff at me saying this, but they're kind of the gold standard right now that we have for trying to understand health outcomes. And these things take years to set up. Yeah. They take a lot of money to fund as well. And then on top of that, they go for years because you're following an individual over a long period of time to try to understand so you're talking 5, 10, maybe more years of dedicated work. Like, you set one of those up, it might be, the next person that comes in, like, you might be retired by the time you see all the benefit of that study.
Oh, yeah.
So, and, I know with ecological studies and environmental studies, it's very similar as well.
Yeah. Well, we have one of our first episodes we had for the podcast. You guys more probably conservation focused in that sense, but it was around building a research project. And that was because of Nathan having folks who were asking him about, like, what goes into developing that, and then why are they so expensive sometimes, and that kind of thing. And it's like, well, there's a lot of factors that go into it. And we do a lot of, kind of preparing to design the best possible study. And of course, then we eventually have peer-reviewed papers that come out of that are driving that forward. And I think it's one of those things that all of the stuff today, it's like we really want an easy button, and it's like kind of you do A plus B equals C, and that's perfect. And that's just not what happens. A lot of the things that we work in, it's so complex. It's A plus B and then some really complicated math formula that are afterwards or so. Yeah.
I wish we were at that point. There was like a point, and it's kind of on that point. There was a point when science could be very easy.
Yeah.
You're like, why does things fall?
Yes. Yeah. I know. Yeah. Absolutely.
Well, that math equation's hard. But
Yeah. Absolutely. Now everything is so complex. But I think I think the thing that we also champion with this podcast is that we want to be able to share. When you're developing these projects, it takes time, and you can't just get a response overnight. That's a lot of these studies, and I would say, yeah, definitely with people, it's not something you're going to slap together and have results within a short amount of time for a lot of things. You're going to, especially if you're wanting to track people through time, that's not going to happen overnight. And so that's so key but you get all that high quality data, and then you got to analyze all of it and then publish on that. And then that's when but again, that could be years of time to see some of that. So.
Well, and that kind of brings up a question for me. So you mentioned those cohort studies where you're following people through life, running all the tests. Why is that the gold standard compared to a lab study where you can really isolate variables?
Yeah, well, the lab study is great, but with that, you're only doing that with mice, rats, those types of organisms. The longer term studies, those are on people and looking at their potential exposure. And this is where I'll make a joke, and hopefully people understand that this is like, we can't do those studies on people, right?
Sure. Yeah.
I couldn't just take people and put them in a facility and be like, you're only going to have this diet, and you're only going to drink this water, and ideally that would be like the best case scenario for understanding these health outcomes, right? If everybody got, you had however many people, and we'll just say we divided them up equally, and we said, okay, from birth, you're only getting this diet, and you're getting 0 nitrate in your water. And the next one's 5, and the next one's 10, and the next one's 20 or something like that. And then we followed them, and we looked at all their health outcomes. Mm-hmm. Well, now that gives us that's more of that causation at that point. Whereas, we just don't do that.
Yeah, that's ethical concerns there.
There'd be some questions being asked for.
Very, very much. I hope that would never get through any IRB process, if anybody's familiar with that. But the closest thing that we can get to that is like some of those studies, like that women's health study that's in Iowa and North Carolina, where they're following individuals over a long period of time. They're able to monitor what their diet is. They're looking at their activity, what's going on in their lives, and then also looking at things like nitrate exposure within their water.
Yeah.
Are there any cohort studies actively going on here in Nebraska or that are looking to start up?
Looking to start up? Yeah.
Oh, okay.
And so that's a great question. And so there's been a number of different discussions that we've been having at the University of Nebraska Medical Center about developing some of these cohorts so we can be able to do this research here in Nebraska and understand what are the impacts here locally. And hopefully there's some investment. The Buffett Cancer Center has been leading some of those efforts. The Children's Research Institute at the Children's Hospital in Nebraska and the University of Nebraska Medical Center have all been talking about developing some of these types of cohorts here in Nebraska so that we can understand exposure over the long term.
So right now, it sounds like you're pulling funds together to start that type of a project. Yeah. Are there any projects that are actively going on here in Nebraska, whether it be testing wells or things of that nature?
Lots. I can't even go into all of them, but yes, there's a number of different studies that are taking place currently, looking at testing wells and continuing to try to explore our understanding of how nitrate and other environmental exposures are relating back to birth defects and cancers and pediatric cancers and thyroid cancers. We've got a lot of different studies. My group is part of those, but there's also other groups that are trying to understand some of these relationships as well.
If there was somebody out there, are you actively searching for people to help with these studies as far as be a subject or a patient within them, or are you not to that stage yet?
Not there yet, but yes, if people are interested in this, I think there would be a real opportunity. I know recruitment's always important because if you have people that are engaged and interested in this and willing to participate, then that's how we make sure that we have the best studies possible. And the more people we have, the easier it is to do these types of studies as well. I mean, the more robust the numbers are, the more robust the study is and the outcomes from it.
Yeah. The more people, the better data.
Exactly.
So if some of these studies that you're proposing are funded at some point, would they just people find out more through a variety, like through the UNMC website, or how do they, and down the road here?
That's a great question. We haven't got there yet.
Okay,
but keep an eye out for what's going on at the University of Nebraska. Social media, I'm sure, will be advertising some of these studies in the near future. So definitely pay attention to those and would love to have people participate in these types of projects in the future.
And I want to pivot a little bit now. You mentioned the Water, Climate, and Health program. Did I say that right? Can you expand on that? What is it and what do they do?
Sure. So this all got formed in 2020, in the year 2020. And I was the founding director of this program. This came about because we had a very generous donation from an individual that was very concerned about some of these environmental exposures and what does it actually mean for adverse health outcomes, especially with kids.
Oh, sure.
And so we got started to try to understand some of these relationships. We look at pretty much anything as far as environmental exposures, environmental health, and how that relates back to human health. And so we have a number of different studies looking at a variety of different areas. Everything from, we've ongoing work trying to understand how drought impacts human health. This is kind of my more passion area personally. Internationally, I'll give you my little spiel. Internationally, droughts have likely caused more deaths than any other climate or weather-related disaster, and that's because of famine and malnutrition internationally. In the U.S., we really haven't identified that as a health concern, but there has been some growing concern around some of these major droughts that we've seen in the United States, and what does that actually mean? We've done some studies looking at finding that we have higher rates of, for example, respiratory-related mortality with drought events, poor air quality, dust, wildfires, etc. We also found that there's an association with extreme heat. Typically droughts are hotter
Yeah.
That time period is hotter than non-drought time periods. And we found that there was more people dying from extreme heat exposure in the U.S. as well. And so we're trying to understand some of these types of mechanisms. But with the Water Climate Health Program, we're not just looking at research. We're trying to see how we can take that research and turn it into outreach, education, and interaction within the community so that we can reduce health impacts as well. And so we've been growing over the last 5 or so years. And now we're at 20 faculty and staff that are being funded through the program.
Really?
And we have
Wow.
15 or more students that are working with us as well.
That's awesome. That's really cool.
Yeah, it's grown. I've been pretty proud of how that's.
I would say so. That's pretty amazing to see that. And it's cool that I like how you're connecting, water and then climate as a whole, and then, the health, back to health, and kind of thinking about all these, like you said, it's all these just complex pieces, and we're trying to pull them all together into kind of one centralized thing to really understand these relationships. And then the other thing I think it's really important, I don't know all the different backgrounds of those faculty members, but thinking about these cross-disciplinary projects. I'm not an ag economist, but I know ag economists here. I'm not an engineer, but I know I have some amazing people in biological systems engineering. And I can work with them collectively and pull together projects. We can look at some really innovative things to drive that, kind of proverbial needle forward for working landscapes. So that's cool.
And we're always looking for collaborations and opportunities to build collaborations with individuals. We have a very diverse team with a lot of different expertise, but we're always looking for people that are interested in collaborating with us. So here at the University of Nebraska or elsewhere,
Sure.
To try to understand some of these environmental exposures and what does it actually mean for health outcomes. But not only just looking at the negative side, but what does it mean when we have different practices in place that could potentially reduce exposure,
Sure.
reduce risk.
Absolutely.
I don't know if I have it correct in my notes, but the Nebraska Environmental Public Health Tracking, is that a system? And then is that part of the Water and Climate and Health Program, or is that something totally different?
It's a really interesting collaboration that we have with, so this is funded through the Centers for Disease Control and Prevention. And this is actually a grant that got that the Nebraska Department of Health and Human Services applied for. And then we partner with Nebraska DHHS, Department of Health and Human Services, to help with implementation of that grant here in Nebraska. I am so excited that we were able to get this. A number of states across the United States has it, but not every state. You have to apply for it. It's competitive. And one of the reasons I was so excited about it was when I was at the Centers for Disease Control and Prevention at CDC, I was on the other side and helping with the implementation of this on the federal side. And so now being here, it's been really exciting to see that actually come to Nebraska and for us to be a part of that. And basically the whole premise of it is it's understanding the environmental health of Nebraska and providing that information, those data to local health departments. And so local health departments are in your front lines. They're the ones that are actually interacting with the community more. They're the ones that are engaging on a variety of these issues, but they're always strapped for resources and time and et cetera. This program is to help with providing data, resources, materials, education, whatever it is, to those local health departments so that they can more effectively work with their communities. And so that's why I'm so excited about this. It's not just about, collecting data, putting it on a website, but it's to really make sure that we're serving a need within the state. And these are doing this all across the country.
Awesome. I mean, it's great that they're trying to get resources and education into those communities. That's outstanding. Are they also collecting data as well on like personal health issues related to certain things or no?
They've got a little bit of data as far as like health issues, but water is one of the things that we're feeding into this as well. And so, because that is consistently coming up with from some of these local health departments that they're concerned or interested in trying to help better educate and do outreach around water quality. And so we're providing water quality data up on this platform so that they can more easily access it and understand what's going on, but then also developing education tools so that they can easily, it's the difference between if you wanted to go tell people to go test their well and you have no resources.
Sure.
Well, what we're doing is developing some of those resources so that that local health department can look at them and say, okay, here's some, a Facebook post or whatever, social media post that they can put out there to help with educating general public around some of these issues.
That's really cool. I like that idea.
That's great. And I think the next thing that should be on there is how to read a printout of your well test.
Yeah.
Yeah.
I think so. I think we need to get there 100%.
Or you have like a dashboard, you punch your numbers in and then it'll tell you like, are these reasonable levels or something like that? And then maybe here's additional resources you get a link to or something like that. I don't know.
Ooh, I like this.
Yeah, we're just piling more work on for you.
Yeah, there you go.
Back.
You can get your team.
If you want to throw us some money while we're at it, we can do this. Yeah.
Yeah, absolutely.
No, I just want to say, do you have any other closing thoughts before we wrap all this up? This was very educational for me, and I really enjoyed taking the time to talk with you.
Yeah, no, I really appreciate it. I think this is an important conversation, and I'm glad that we're doing this kind of engagement around this issue. The one thing that I want to say is, my goal isn't just to like scare the heck out of people about this stuff. That's not the premise of it. I'm not trying to demonize anybody for anything as well. What we're trying to do is make sure that people understand what are those potential risks so that they can make informed decisions for themselves. Yep. And I would say the first thing to do is if you're on a private well, get your well tested. Yeah. Understand what's going on. And then 2, know that there are opportunities to mitigate against that. Everything from a reverse osmosis system at your faucet or throughout your entire house that can help with reducing those risks. And then there's steps that you can take afterwards to make sure that you're continuing to reduce your risk within your house. But then there's broader steps that we can take as well collectively to try to reduce risk just for our water systems as well.
And we'll get the link from you or some websites to throw up when the podcast comes out for folks to look to. But where should they go to learn about some of this information?
Well, you can go to our website at the Water, Climate, and Health Program, and happy to send that information on to you so you can be able to put that up. Also, if you're here in Nebraska, you can go to your natural resource district. They have resources available around this. Nebraska Department of Health and Human Services. And also, and this is not just Nebraska, obviously. I know you have a much broader audience than just here. But you can go to your local public health state public health agencies. You can go to your environmental protection agency within your state. Here in Nebraska is it's changed its name, but it used to be the Nebraska Department of Energy and Environment. I don't know what the name changes now. And these are where you can find some of these resources to better understand what's going on and what is the potential health impacts, and then what are ways to potentially mitigate against those as well.
That's really good, and I'm glad that I really enjoyed this conversation today. And one, I learned a lot, so there's a lot of things I'm learning through this whole process about nitrates. And I think it's so important that we have these conversations, and we were talking off air earlier about just the importance of being able to communicate a lot of these things out to the public, and then also drive innovation around, how do we, once we're learning some of these things, what are some of those mitigation steps that we can take and implement? And I know that's, what other people are working on right now and kind of thinking through, different technologies that can help optimize our water systems in the future and address nitrates and other, like you said, atrazine, other contaminants that are in our water systems. But yeah, again, I think it's been really fascinating. I really appreciate you taking the time to come visit with us and chat a little bit more, and love to have you back on in the future and dive into some more of these topics, and kind of continue to learn more and be more educated around nitrates. So yeah, love it.
When that cohort study kicks off here in Nebraska, we'll bring him back to talk about all the results.
Yeah, there we go. Yeah.
Yeah. So one last time, test your wells and eat healthy foods.
Absolutely. That's a good way to sum it up.
Thanks for listening, everybody.
Are you enjoying the Wild Ag Podcast? You or your organization can sponsor upcoming episodes that bring important information to listeners just like you. To learn more, visit our website, go.unl.edu/wildag.
Wild Ag is part of the Natural Resources University Podcast Network. If you enjoy this podcast, please leave us a review so others can find us and tune in.
And we want to hear from you. You can submit questions or topic suggestions to us at wildagpodcast@gmail.com. That's WILDAG podcast@gmail.com. Thanks for listening.